A lot of patients who come to us after they've done IVF treatments in other clinics are quite scarred. And there are two things which scar them. One, of course, is the fact that a lot of doctors don't spend enough time explaining to patients what the treatment is, what the side effects are, what's going to happen next, why the cycle failed. And patients feel cheated. They feel that the doctor didn't tell me anything. The doctor was very sweet when they wanted to take my fees, but during the cycle, I could never see the senior doctor. And after the cycle failed, they've completely abandoned me. So there's a lot of emotional scarring involved after a failed IVF cycle. But unfortunately, patients only learn the hard way. And once they've had a bad experience with an IVF doctor, they're very reluctant to trust any other IVF doctor. And I get that. But it's not just the emotional scarring. There's a lot of physical scarring too. A lot of patients are made to wait unnecessarily for hours on end. There's a lot of opacity. There's no idea about what's happening. They don't know whether follicles are growing. No one shows them the ultrasound scan pictures. They don't know what the E2 levels are. They don't get to see their embryos. And what's worse is they're injected with all kinds of painful shots, completely unnecessary. So they're forced to take subcutaneous low molecular weight heparin shots, which are so painful and bruised. They're forced to take intramuscular progesterone injections, which actually are so painful that you can't even sit on your butt after you've taken two or three. And the worst thing is, this is all gratuitous pain. There's absolutely no reason why a good IVF clinic should subject patients to all this unnecessary physical scarring. And that's the one thing we take pride in. We reduce the stress levels in our IVF clinic. We actually make the process much kinder, much nicer, much easier. For one thing, it's only Dr. and Anjali and me who take care of all our patients. So it's all one-on-one, very hands-on. And equally importantly, we don't use intramuscular progesterone. We don't use low molecular weight heparin. And we tell patients upfront exactly what's going to happen. So that not only is their physical pain a lot less, their sense of knowing what's going to happen, of being in control of the IVF treatment cycle itself is much more. So their anxiety levels and stress levels are much less as well.